Now, the number of health workers infected with the coronavirus in Nigeria keeps rising as the country battles to halt the spread of the virus. All over the world, there are complaints of insufficient provision of personal protective equipment for frontline workers, and the story is not any different here. Health workers in both public and private centers have been lamenting the lack of suits, face shields, gloves, and other protective gears that will limit their chances of contracting the virus while attending to infected persons. Now, joining me via Skype is CEO, Occupational Health and Safety Managers, Ehi Iden. Good morning, and thank you for joining us on TVC Breakfast.
Good morning.
Now, the situation is not any different across the world, what we are witnessing here in terms of the safety of frontline workers. And according to reports, about 90,000 health workers across the world have been infected. But when you look at the effort being made by the Nigerian government, are we doing enough to protect the frontline workers, talking about the healthcare workers at this time?
Yes, good morning. It is a general issue, not just in Nigeria, but globally. As the pandemic became a key issue, the demand for personal protective equipment escalated worldwide. And if you look at last week's research, most of the PPEs that were available were returning back to China, purchasing them back to China because they were the one that had even the coronavirus earlier. But it's a general issue because those who would have manufactured this equipment the factories are not opening. So there will be a global shortage. Nigeria is not left out. Most of us have cried out on even how to reach out to healthcare workers with required PPEs. Understand the fact that here in Nigeria, we don't manufacture PPE, so we rely on global supply. So we're not having enough to cover those that we have as frontline employees. Definitely there'll be infection. When you have pandemic as this, there'll be infection, at a very high rate. But all that we're just hoping is that it doesn't escalate beyond this, that this is able to overcome the infection and survive it. But are the healthcare workers really protected enough? The answer is no.
So are you saying that achieving a safe work environment for the frontline health workers in the midst of the shortfalls, challenging environments, like you have rightly pointed out, in a pandemic is practically impossible?
Not practically impossible. Understand that we are in pandemic. Every country of the world is suffering from it at the same time. And the demand for PPEs, they all go high. So this is what we're going through. So if you have the fund, even accessing the right kind of PPE is even difficult at this stage. So you find out that the few ones that are in the market, the prices have gone astronomically high, and people can't even import in because there are no flights coming into the country. So even we have been trying to bring in some PPEs lately. We can't bring them in because there are no flights coming in. So it's just going to be difficult. If you even look at the report that was shown in the US, why the healthcare workers were talking to President Donald Trump last week, one of the nurses said that she had to keep recycling her nose mask. So it is a key issue. So I understand that this is disturbing. We have to go through it together at the same time. But are we going to get over this? We should learn from this and maybe going forward, knowing that the basic PPEs that can be produced here, let's look inward and start produce them here in case of further medical emergencies that we have right now in the country.
We have begun to see the production of medical PPEs locally. We've seen the production of masks and even the clothing that we see some healthcare workers use. But how much difference would that make if we begin to push that as a government?
Well, that will make a whole lot of difference because, one, it reduces the time, the turnaround time at which PPE can get to a healthcare worker. Because what is produced at Enugu, produced at Unewi or Abeokuta can get to a healthcare worker faster than what is produced in China or what is produced in Germany. So this is a very good one. Again, it also saves us on the funds that we repatriate in trying to get this material. So this is a very good cause. I'm happy that it is happening. Even right now, even the ventilators, I have seen biomedical engineers rising up and trying to fix our ventilators. I think this is very good and should be upheld. even after the coronavirus, let's start producing this thing within, so that, I mean, we can have these things to use as we want, and the funds remain in the country. But this is a very good one. I think it should be applauded and taken up in going forward.
Now, another aspect that was pointed out by the WHO is the aspect of adequate training of healthcare workers on the front lines, as some of them might not really be able to detect where patients are asymptomatic, especially, may not be able to read who these patients are or detect that these patients have COVID-19. How much of a challenge does this also contribute as we talk about the safety of healthcare workers?
It is a big challenge. If you go back to the earlier report that came out in China, you realize most of the healthcare workers that died were nurses. And these are nurses that were not trained in infection control and prevention. But the doctors, the physicians, they had those trainings. So they didn't have enough knowledge on this. That's why they recorded early deaths among nurses. It is a big problem, not just here, but global. I think what we should start doing is that as the rate increases, let's start training our nurses. But one thing we have learned here also is that infection prevention and control is an integral part of healthcare. We shouldn't wait till we have pandemic before we start training our nurses. Disaster management plan is not drawn in the face of disaster. It is put in place before disaster happens. And we're also getting reports that most nurses and most healthcare workers are not even able to wear and down their PPEs correctly. Some are downing their PPEs and getting themselves reinfected. These are trainings that ought to be on ground before now. But we have it right now, but I just think we learn from it. Let's understand that infection control, PPE, they are an integral part of this process, and we learn how to incorporate the whole package together so that we can keep our healthcare workers safe.
All right, Ehi, then we'll leave the discussion for now. Thank you for speaking with us.